Welcome, everybody. This is Thursday, November 19th. It's 1 o'clock. This is the Washoe County District Board of Health meeting. It is being held all virtual, so we'll do the best we can on, finding everybody. If somebody needs to raise their hand and wave and yell, that's perfectly fine to get this going. So, Miss Susie, can you do a roll call for us? Susie?
I'm hearing you, Susie.
Chair Novak,
Here?
Vice Chair Brown,
Brown's here.
Councilman Dare,
Here.
Dr. Danko,
Here.
Councilman Delgado,
Here.
Tom Young.
Here.
Commissioner Burke-Bigler will be absent. We have a quorum, Chair.
Okay, good. Thank you very much. Councilman Dare, can you lead us in the pledge, please?
Sure.
Just happen to have.
Yay, wave it proudly. If you join me, I pledge allegiance to the flag of the United States
of America.
and to the republic
For
Which it stands,
one
nation,
one nation, under God, indivisible, with
and
liberty and
justice. Crowd says, yay!
Hey. Then they usually yell, play ball. Good. Okay, we are open for public comment. Susie, you want to start, please?
Yes, Chair. We have 4 comments, and I have Diane Hirschberg on the list, but I don't see her present. So I think we're going to move on to Miss Judith Miller, followed by Dr. Carol Black.
Okay. Ms. Miller?
Thank you. Good afternoon, board members. Thanks for this opportunity to make a comment related to the proposed public accommodations regulations. I've been a member of the Incline Village Crystal Bay Citizens Advisory Board. Marsha Burke-Bigler appointed me back in 2014. And I have heard from many of our residents and their concerns over the lack of health regulations as they pertain to short-term rentals. One of those citizens, she's a trustee for our Incline Village General Improvement District. Her name is Sarah Schmitz, and she made a very compelling statement before the Board of County Commissioners on this very subject back on August 25th. Here's what she had to say, quote, "I'll share the STR short-term rental cleaning crew perspective. The people cleaning the homes know there are no minimum standards. There isn't even a requirement to change the sheets. Last weekend, I observed a 12-person bachelor party. They trashed the entire backyard, were cited for disturbing the peace, and upon their departure, I inquired with the house cleaner. She said they completely trashed the house and that she was the only cleaner and had about 4 hours to clean a 6,000 square foot home occupied by 12 people. When the next renters appeared and I inquired with them regarding the condition of the home, I was told of bloody bedding covered with semen and general filth. Upon their departure, I spoke to the next 2-person cleaning crew. They shared their frustration. They told me there are no cleaning standards and that sheets regularly go unchanged. Bedding that is covered with semen is just flipped over since there's no time or requirement to have them cleaned. They told me hot tubs are checked for water level, but no chemical testing or cleaning is done. Given our new normal, this is completely unacceptable. If owners are allowed to run their essential business during this time of pandemic, they must be required to have sanitary requirements and 72 hours between guests, just like hotels, to clean and monitor hot tubs, just like hotels. The local property managers should be signing off on a checklist of cleaning requirements and have them posted at the property and online so renters can have faith they are going to be safe." End of quote. Please don't overlook short-term rentals in your efforts to protect the citizens of Washoe County and our visitors, not just in this time of pandemic, but as long as short-term rentals are allowed to operate. Thank you so much.
Thank you, Ms. Miller.
We now have Dr. Carol Black.
Okay, Dr. Black, your turn.
Can you hear me or am I muted? I hope you can hear me.
Yes, ma'am, we can hear you.
Okay, thanks. Sorry. So I'm a retired physician. Just a second of background. My experience prior to Incline Village retirement includes MIT basic science, a Harvard medical degree. I practiced internal medicine for about 20 years, have managed large multi-specialty practices, health plan programs, and consulted nationally on quality, efficiency, effectiveness of clinical programs. I mention all this as context for the comments to follow related to the Health District Public Accommodation Policy Draft. First, background. As your health officer was quoted in recent Health District minutes, he has statutory responsibilities under state law for controlling or preventing the spread of communicable diseases. And per the special legislative session in NRS 439 and 447 as amended, the District Health Department has jurisdiction over all public health matters in the health district with an exception around some emergency services. And public accommodation facility means, and I'm quoting, a hotel and casino, resort, hotel, motel, hostel, bed and breakfast facility, or other facility offering rooms or areas to the public for monetary compensation or other financial consideration on an hourly, daily, or weekly basis. Now, consider the historic health district stance and current proposal regulations governing public accommodation facilities, where short-term rentals and sometimes B&Bs are considered separately and either completely or partially exempted or excluded from the extensive, thoughtful public health and safety regulations. How can this be? Short-term rentals fit the public accommodation facility definition, and B&Bs are listed. Identical or very similar activities, clinical risks occur in these and other public accommodation facilities. Further, STRs are less well supervised and often maintained on an ad hoc basis by per diem arrangements. You just heard some actual observations. What are potential exposures? In FY 1920, STRs accounted for 80,000 RSCVA occupied room nights, 90% in Incline Village, disproportionately increasing risk in our tiny village. By contrast, in Washoe County, mostly in much larger Reno and Sparks, in 2019, RSCVA reports about 152,000 total convention nights and a minority of STR nights. So we got a lot going on in Incline Village. What are the exposure risks? You know them. COVID, respiratory and blood, bodily fluid pathogens, sharps, needle sticks, vermin, insect vector disease, mold, etc. And nuisances, bed bugs, scabies, and lice. I attached to my written comments a couple of cute pictures if you want to look at them. So what is the health district's plan to protect the public health and safety of STR guests, owners, workers, and the community, particularly in Incline Village where they are concentrated? Exemption is not reasonable or responsible. Please create a safe plan. Thank you for your time.
Thank you, Dr. Black. Okay. Susie, who's next?
If we don't have Pamela Sigdano signed on, that would be it for public comment, Chair.
That's it for public comment? Okay. Very good. Then moving on to item number 4, which is approval of the agenda. You have the agenda sent to you before. Is there any changes to the agenda? Okay, hearing none, I'll take a motion.
Brown, make a motion to approve.
Okay, first.
Second, Derek.
Rita, second.
Okay, very good. Thank you very much. Mr. Health Officer, recognitions.
All in favor?
Oh, I'm sorry. All in favor.
Aye.
Thanks, Chris.
Aye.
Opposed? Hearing none, passed. Recognition, Mr. Health Officer.
Thank you, Dr. Novak and Mr. Chair. Today for recognitions, I'd like to begin with years of service and like to recognize Andrea S. for 5 years of service with EPHP, and also Heather Homestead, 10 years of service with CCHS. So I should mention Andrea is the program manager in EPHP for our EMS and public health preparedness programs. Heather Homestead is a public health investigator in CCHS. And also Kara Roseborough for 5 years of service, who is also in CCHS. The promotions, I want to recognize Chantel Batten. She was promoted from environmental health specialist to a senior environmental health specialist in Environmental Health Services Division. And I just want to recognize that there were a number of exceptional candidates for that position, and congratulations to Chantel, but also all of them for applying for that position. And then we have special recognition this month for Dan Inouye with our air quality management in the supervisor for monitoring and planning there. Dan is being recognized by Green Nevada, and I believe Green Up also, with a Golden Pine Cone Award this year. And the Golden Pine Cone Award is the most prestigious recognition for environmental activities that we have in Northern Nevada. And so this is a significant honor for Mr. Inouye, and wanted to recognize that and congratulate him for that. So with that, that concludes our recognitions today. Thanks to and our appreciation to all of these staff members.
Good. Well, thank you. And very big congratulations to Daniel. I know this is a big thing for him to have happen, and all of us for that matter. Okay, item number 6 is the consent agenda. I hope everybody has reviewed it. I will take a motion. Is there any changes that need to be pulled off? Anything needs to be discussed? Hearing nothing, I will entertain a motion to accept the consent agenda.
Move to accept consent.
Okay, first, Oscar. Second.
I'll second it.
Okay, Mr. Young, the second. All in favor?
Aye.
Opposed?
Aye.
Hearing none, we will move to item number 7. It has passed as is. Okay. Mr. Dow, are you there?
Mr. Dow, unfortunately, is unable to be with you today, but I am here, Mr. Adam Hines.
Okay, thank you, Adam. Go ahead.
Good afternoon. Good afternoon, Mr. Chairman, members of the board. Adam Hines, Executive Director, Integrated Health Services for REMSA. And for your record, you've all received a copy of our October compliance report for review, and I'm here available to answer any questions that you may have.
Any questions by anybody on the board?
I just have a statement.
Okay, go ahead.
Thank you. I just want to say, one of the things you guys put on there is your benchmark, and good job. I think that sometimes we see these reports come and go, but that's a lot of people you are meeting, a lot of people you're helping, and to get above score of your benchmark and to see that is what we want to see. So I don't know that we cheer you on enough, so I want to make sure you see that. Good job.
Good. Any
Thank
other
you.
comments or questions? Okay, we need to accept the report. I will entertain a motion to accept the report from REMSA.
Motion to accept the report from REMSA. Rika Danko?
Okay, that's first. Any
Second, Delgado.
Second, Delgado. Any discussion? Okay, hearing none. All in favor?
Aye.
Aye.
Opposed? Hearing none, it is passed. Okay. Oh, hi there. Hi, Alexa.
Hi.
You're on.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for REMSA, for the record. You have for your review the Public Relations Report for October. A great deal of our time recently, though, has been spent on supporting the efforts due to reduce the spread of COVID-19 in our community, from coordinating with the healthcare and faith community leaders on testing events, to increased communication to employees, to working with the Joint Information Center to identify new ways to share messaging and overcome the message fatigue that we all seem to be hearing about. In addition, we have welcomed Spark City Manager Kretz and Washoe County Manager Brown, as well as Dr. Danko, to ride out with the community healthcare vehicle. And of course, as a reminder, you all are welcome to schedule a ride along with Executive Director Hines to learn more about how this special resource is supporting the out-of-hospital healthcare in our community. I know you're all busy right now, so it's a standing offer. We're happy to host you at your convenience. And otherwise, I'm happy to answer any questions that you may have about our public relations report.
Any questions? Hearing none, thank you very much. We appreciate
Thank
the
you.
hard work. Okay. Just for a matter of logistics, we have one member that may have to leave a little early, so I am going to change item 8 and 9 as far as position. So we're going to take on the discussion and possible adoption of the business impact statement, and it's to be presented by Mr. English. Jim?
Chair, it'll be Wes Rubio
Okay.
who will be presenting.
Wes, are you there?
This is James English of the Washoe County Health District here to present this item. Computer locked up on us. Good afternoon, Chair and members of the board. James English, Environmental Health Specialist, oversight of the Permanent Facilities Program. What you have before you is the business impact statement for the proposed regulations for public accommodations for a standalone local regulation to be adopted by this board for enforcement by the Washoe County Health District staff. We have never had a standalone regulation for this program. We have always relied on the state NACs. With the adoption of the SB4 and the NAC 447E regulation, it made sense to have a complete local regulation for our staff to use as the standard for inspections. We have been working on this regulation for the past few years. It was originally drafted in 2015 and now seemed to be the correct time to bring that forward. With that, we went ahead and did 2 public workshops. We had 74 affected facilities with this proposed regulation. In my 20 plus years of doing regulations here at the Health District, I've never seen such turnout for these regulations. We had 22 people attend a Zoom call on October 21st and 32 people attend a Zoom call on October 22nd. We had no questions that pertain to any financial impact, positive or negative, for these regulations. We had some questions on some new definitions, but no one posed any concerns about what these regulations would mean on the impact of their overall business model or operations. Furthermore, this regulation would allow us once again to issue health permits to operate to these facilities. Currently now, we are only allowed to do an inspection and provide them a notice of inspection report. This will actually put us in the position to not only do the inspection, but then give them a health permit to operate like all the other areas of these facilities we inspect in other programs, such as food facilities, swimming pools, spas. With that, that concludes my update, and you can look at the business impact statement, but there is nothing we needed to highlight at this point in time. We were able to make contact with every single property, either by email or mail or personal phone call, to let them know these regulations were moving forward. So we had a great turnout, and we've had no follow-up questions or concerns related to these regulations since the public workshops. Thank you.
Okay. Any questions for Mr. English? Hearing none, we will vote to accept the report. We will revisit this issue at our next regular meeting. So as far as that's concerned, we'll just move on to the next thing after accepting the report. Okay. Number 8, presentation and possible acceptance of a 1-year extension for the community. Yes.
I'm sorry, Mr. Chair. This does appear to be an action item for the adoption of the business impact statement. So that would require a motion and a vote, please.
Okay, that's fine. I thought we'd vote on it next time when it came up. So, Okay, we need a motion to accept the report.
Brown will make the motion to accept the report as presented.
You have a second?
Second, Delgado.
Delgado. Any comments, questions, discussion? Hearing none. All in favor?
Aye.
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 Opposed? Okay, hearing none. Good, we've taken care of that. Thanks, Ms. Reed.
Thank
Thank
you.
you very much.
I just may clarify for the record, that was the adoption of the business impact statement. And as the chair has pointed out, the actual regulations will be up for consideration at the next meeting.
Yes. Thank
Thank
you.
Right. Good job, everybody.
Okay, yeah, a lot of work went into this one. Okay, we're going to go back to item number 8, presentation and possible acceptance of the 1-year extension of the Community Health Improvement Report. Okay, who's going to be giving the report on this?
Sure, I
Kevin?
believe that'll be Rayana Lavoy and
Okay.
Ms. Julia Ratty.
Okay, very good. We're ready. Take it away, please.
Okay, can everybody hear me okay?
Yes.
Okay, perfect. So good afternoon. Oh. I can start. Okay. So good afternoon. For the record, my name is Rayana Lavoy, and I am a health educator in the Office of the District Health Officer's Office. And joining me today is my colleague, Julia Ratty. Today we'll be presenting the 2021 Community Health Improvement Plan, which is an extension of the 2018 and 20 Community Health Improvement Plan. So the Community Health Needs Assessment and the Community Health Improvement Plan are 2 core documents required to be an accredited health district by FAB standards. These documents are due to be updated every 5 years. To conduct our last Community Health Needs Assessment, we collected primary data by sending out a community survey, and we also collected secondary data from sources like YRBS and BRFSS, to name a few. We then examined the health status indicators for Washoe County and used it to identify key problems and assets in the community. The top 3 needs that rose to the top were housing and homelessness, behavioral health, and physical activity and nutrition. Next slide. Thank you, Julia. The Health District has traditionally partnered with renowned and Truckee Meadows Healthy Communities to update both the Community Health Needs Assessment and the CHIP every 3 years. However, given our current reality with COVID, many of our partners, along with us here at the Health District, are responding to COVID-related priorities and are sifting through some challenges that are related to that. But here's the good news. We still have 2 years before we have to update our Community Health Needs Assessment and our CHIP. So we're decided that we're going to extend the CHIP for 1 year instead of doing a full update. Renown is currently working on an update to their Community Health Needs Assessment, so we'll be excited to hear if any of those health indicators have shifted at all. Next slide. So as most of you guys know, the CHIP includes really important work aimed at improving the lives of our residents, so we certainly don't want to lose momentum on the good work that we've already accomplished along with our partners. As we're responding to the crisis of COVID, we still want to make momentum on some of the things that we can do over the next year. There's a strong desire from our community partners to continue to work together on efforts that will help us move the needle in all of those focus areas that were listed earlier. Many of our partners have also told us that some of the existing challenges that our residents were faced before the pandemic have been further exacerbated by COVID. And so we're going to address those, and you'll learn more about them in the slides ahead. Next slide. So when we made the decision to extend the CHIP for 1 year, we wanted to ensure that we were collaboratively working with our stakeholders to understand where there was momentum to continue into the next year. So we met with community stakeholders from our current CHIP committees, and then we also included new subject matter experts that are working in the fields of those focus areas. From those meetings, we gathered themes and items that were frequently discussed, and then our partners helped us to develop action plans that outline specific objectives, strategies, and tactics on how we'll collectively implement the activities identified. Next slide. So here's a look at our work plan. When we started to get on this mission of extending the CHIP, we started to have meetings with our committees to check in on their progress with the current CHIP activities that were included in the 2018-2020 CHIP. Most of what was written out has already been accomplished, and they're ready for us to take the next step. So that's good news. And when we convened with our partners through several meetings, we then decided to start working on those action plans, in which we're going to present to you today. Next slide. Oh. Perfect. So where are we now? The 2021 Community Health Improvement Plan includes new goals and objectives that will engage the community to move the needle on housing and homelessness, behavioral health, and physical activity and nutrition. So I'm going to turn it over to my colleague, Julia, and she's going to give you more of the highlights in each of the focus areas.
Thank you, Rayana. So as my colleague mentioned, there are 3 focus areas in the Community Health Improvement Plan. And one of the first focus areas is housing. In the Housing Action Plan section, we stayed pretty closely aligned with the work that had been done in the prior two years, but added some new strategies and objectives. So one of the things we did was continue the work on the regional strategy for housing affordability. That was a significant lift by Truckee Meadows Healthy Communities, working with Enterprise, and there's still lots of work to be done in our community. So there are a couple of objectives in the plan specific to that. We are advocating for funding to build new affordable housing and policy to preserve existing affordable housing stock. So those are some legislative asks. The community has been working on what's known as a 1959 Medicaid waiver. That is a waiver for more Medicaid funding for low incomes, mentally ill folks to be able to support them in housing. And there was a lot of input from the community that we have a lack of affordable housing for people who have a mental illness, so supported housing. One of the very sort of current conversations in our community is around case management ratios for individuals experiencing homelessness. And as many of you know on the board, lots of conversation around that. And so the CHIP does advocate for national best practice standards for case management ratios in our community. The CHIP also under housing rallies around the Built for Zero initiative to end homelessness. Oftentimes the CHIP is lifting up good work that's happening in the community. And then it does have a focus on what's happening through the continuum of care with getting to evidence-based practice and with some lessons learned from the COVID-19 pandemic. How do we do a better job of integrating homeless services providers into the emergency management response? So this is an example of an action plan. This is the housing action plan. You'll be happy to know that we are not going to go through this line by line, but we just really want you to have an example. So here's a goal over to the left, and you can see that, for example, on this first goal, there's 3 objectives that were complete. Those were the objectives that were in the original CHIP. But now if you look at numbers 4 and 5, we have modified this goal to include new strategies, and it's got a new deadline of 2021. And number 5, we have added a new objective and strategy under this goal. So you'll see that throughout the CHIP, where we didn't eliminate the work that was already there from 2018 to 2020, rather showed what was completed or still in process, and then added some new objectives and strategies where there was new work to be done. So there are, in the housing area, these 2 goals. Then if we moving on to behavioral health, the behavioral health conversation was probably one of the areas where there was the most energy and interest from the community. Under the behavioral health highlights, we are going to continue to collect data and information to inform future investments. This is an area where there was probably some weaknesses in the community in terms of our access to information, and we want to continue to stay focused in that area. We're going to recommit and refocus our efforts to address isolation and suicide. We want to work on improving our crisis response and support. This is specifically in alignment with the Crisis Now model that many of you may have heard about in the community. We want to expand intensive multidisciplinary support for individuals with complex needs. So this is really targeting that small group of individuals who have a serious mental illness, but utilize a significant amount of resources and require a lot of support in our community. And so this is talking about trying to get to a place where we have more intensive multidisciplinary teams to support those individuals. A lot of conversation about not having enough access to care for adolescents. And so there's a big chunk of the CHIP that's focused on that. And once again, learning from our experiences with COVID-19, there's some goal, strategy, and objective in the CHIP that is designed to improve our response, behavioral health response during an emergency. And again, here's just an example of a summary of the action plan that is in the CHIP with multiple goals here, the little hints in bold about if this is a new goal, an extended or a new objective, an extended objective, or just a whole new area. Particularly in behavioral health, there's a lot of continuing the ongoing work with a refocus and a recommitment. And then there are 2 new goals in the behavioral health section, and those are the ones specifically around some of the intensive care and around the emergency preparedness. Rihanna?
Perfect. Thank you, Julia. So as for the physical activity and nutrition focus area, we're going to continue to work on 5210 Healthy Washoe with our committed partners who have said that they would be implementing the program. We'll continue to work with pediatric offices to implement the program. We know that some that have committed to that are still doing the 5210 Healthy Washoe program, and they're asking families and implementing the Healthy Habits questionnaire and starting to have conversations with families about what healthy eating and physical activity sounds like and looks like. So that's great news. So we're going to recommit to our 5210 Healthy Washoe program. And then we're also going to continue the family health festivals. Those events continue to grow every time that we hold a family health festival, and more families continue to come to those knowing that they can get direct services. So we're really proud of the work that we've accomplished with those family health festivals. We are shifting the work a little bit because we've had to modify the way that we lay those events out. Now that we have family health festivals, we're only making them a drive-through model. So most of our partners are providing resources, and we do hand out resource bags because we limit the amount of partners that we can have on site at one time. We are going to continue to expand our work and make sure that we improve the access to foods by working with a pilot program and implementing healthy convenience stores. And something exciting to note is we will be developing a GIS map so that we can help families access food resources and give them an understanding of what they can use their food benefit and commodities, maybe at like farmers markets or stores. So we're really excited about that work there. And then something that is new to the physical activity and nutrition focus area, when we were learning from our stakeholder interviews, the Washoe County Nutrition Services said that they had found a gap in those students who were at home distance and participating in distance learning. They were struggling to get meals at the sites from the sites that were located in Washoe County. So we're working with them to make sure that we're expanding those sites and to make sure that those students have access to food as they would if they were attending school in person. So those are some of the highlights from the physical activity and nutrition section. Julia, do you want to turn it over to the next slide? These are our action plans. Nothing has really changed here other than our environment section. Again, like I said, we're going to be working on a pilot program. We're going to be working with the community and clinical services department to be able to implement that program. And our next action plan, Julie, thank you. And then again, we'll be working with Washoe County Nutrition Services to be implementing and helping them expand their sites. So with that, what's next is we're going to officially launch the 2021 Community Health Improvement Plan with our partners, and we'll do that in January so that we can start working on all of the items that we've committed to. And then we're also going to present the 2021 annual report That report will cover all of our accomplishments and the progress that we've made over the last year. So you'll get specific updates on all of the items that were included in the 2018-2020 CHIP. And then finally, we're going to continue to have conversations about our readiness to commit to implementing a new update of the community health needs assessment and our community health improvement plan. So with that, we'll take any questions that you might have.
Very good. Any questions by the board? Any comments?
This is Tom Young. I just have one comment. I do think that in reading this report, I was reminded once again of how complex it is to find balance in our society to try to balance our great public health and the betterment of our community. And I'm applauding the efforts so far, and I want to see some good continuations of some of these programs and see if we can do a great job of balancing it as we have in the past. Thank you.
Good, thank you. Any other comments or questions?
Yes, Christopher.
Okay, Chris.
First, I do want to also say it's so important we keep on this, because what it does is it takes all the things we do and it brings things to the surface of what we have to keep our eyes and everything on. So thanks for doing that. I do have a question just regards to the possible tsunami of evictions and things of that and how that fits into this. I mean, I know we're all concerned about it, and obviously that's going to hit on the home portion side. Do you mind speaking to that at all? Because it's probably the thing that right now is keeping me truly, I don't know what to do about it. I feel like we're all trying to come up with answers, but it's a concern that we're just kind of waiting for and then ready to try to help, but I don't know.
Rihanna, would you like me to take that one?
Please.
So thank you, Councilman Dare, for the question. It's an excellent question, and I wish that I had a simple answer for you. There are certainly things in the regional strategy for affordability that would address some aspects of that. I think that part of the challenge is, how far can we go upstream on the crisis of eviction? And part of the reason that we have so many people who are at risk of eviction is, of course, that we're in the middle of a pandemic and people's employment has been interrupted and those kinds of things. But the other piece of that is how many people are living in our community who are spending more than 30% of their income on their housing, because the housing affordability is just becoming out of reach for such a large percentage of the people who live here. And when housing affordability is when you're spending 50% of your income on housing instead of the recommended 30%, that also means that you're not allowed to, or not allowed, but not able to set aside money for savings. And so then you are very much at risk of eviction in a very short period of time, whether it be this pandemic or other sort of personal issues that impact you. So while I don't have great answers, and I don't know that our community has great answers about the looming, what happens January 1st when the CDC eviction moratorium is lifted question, except for the good work that the Supreme Court has done on setting up a mediation program. And I know the city of Sparks has also set up your own mediation program. And I think that those are incredibly important steps. And we should all double cross our fingers and hope for an extension of congressional package that will help local governments and will help then local governments provide assistance to our residents and to the landlords who've been put in a pretty significant challenging position because of the moratoriums. We really don't have a great answer. The one group that I would like to highlight is our legal aid nonprofits, who I think are doing yeoman's work to reach all of those tenants and get them the information about the CDC moratorium, how it works, what paperwork you have to file. And I think that anything that we can do to lift up their work, the work of the Reno Housing Authority, and then we're just gonna all have to be prepared to quickly lean in as much as we can, but there aren't good comprehensive solutions if there isn't more assistance come January 1.
Thank you. Yeah, thank you for your comments. I agree, and just very concerned. So as we go down this road, I think it's something we just try to keep close on. I do hope that we can have some conversations come January to try to know where we're at and what what is the outlook of all this? Thank you.
You bet.
Cool. Any other comments, Rain?
Yeah, Chairman Novak, this is Oscar Delgado. I think Ariana touched on this one, on the physical activity nutrition highlights. If there's a way you guys can pull up the slide really quick, I wasn't able to write it down. But I think it was related to the convenience stores. Are you guys at all working with the city arena or working with any other jurisdictions with respect to just convenience stores and liquor licenses and licenses in terms of privilege licenses and so forth to move forward in terms of providing more produce or healthy foods at convenience stores?
We haven't started on the work yet. We'll be working with CCHS to start on the pilot project. So we were going to first start with an assessment of what they currently offer and then select 1 or 2 convenience stores to be able to help include more produce in those convenience stores that may not have access to those.
I'd highly recommend for us to reach out to the city arena. We currently have a moratorium. I've kind of spearheaded an effort that where we've kind of put a moratorium on alcohol privilege licenses or packaged liquor licenses across the city. One of the efforts is to make sure that we have some fresh produce in many of our, if you have packaged liquor, then you also have produce in terms of our food desert. So if there's a way to get them some white papers, some research to say why we should be doing that right now would be a good time to start reaching out to our either it's Angela Foos or Arlo Stockholm to make sure that they have what they need to get us going again. So it's been delayed because of COVID and everything else, but it's a great opportunity to engage.
Okay.
So please do that.
Thank you.
I think I had one more.
Any other good comments?
That's it. Thank you.
Good, thank you.
Good job.
Ms. Lavoy, thank you very much. Senator Ratty, we really appreciate all the efforts of both of you. This is a big project. It just opens more questions sometimes and provides answers, but I think we're at least heading in the right direction on paper right now. We'll see how the pandemic lets us move on from there. So thank you very much. Okay, moving to staff reports.
Mr. Chair,
Yeah.
sorry again for the interruption.
I'm sorry, I missed that one.
This is an action item for acceptance of
We
the
accept the report.
Move to approve.
Okay, move to approve first.
Second, Rika Danko.
Okay, second, Lisa Danko. Any discussion? If not, I will accept the motion, and all in favor?
Aye.
Aye.
Opposed?
Aye.
Hearing none, passed. Thank you. Okay, now we will go to air quality management. Mr. Vega. Francisco, are you there? Okay. Hearing nothing, he might be lost in space. For the CCHS, Ms. Lockridge.
Hi, this is Lisa Lottritz, Division Director for Community and Clinical Health Services for the record. I just wanted to provide an update on our flu clinics. To date, we have given 789 vaccines in the clinic, and we've provided 2,540 out in the community for a total of 3,329. We have 4 additional clinics this week, but we have to date doubled the flu doses that we've given from this time last year. CCHS is also working with EPHP on planning for the COVID vaccine. We're developing our COVID vaccination plan and plan to present that to the state on Monday. And just working with our Tier 1 groups to let them know the plan when the vaccine is available. That's all I have, but I'm happy to answer any questions about my report.
Good. Any questions for Ms. Lockridge? Okay, hearing none, moving on to environmental health services. Ms. English.
Actually, this is Wes Rubio, acting director for this month. No worries, it's incorrect on your paperwork, Dr. Novak. You were correct.
Thank you.
I believe you have the staff report in front of you. I'm available for any questions if you have any. I don't have any thing further right this second. Be more than happy to answer any questions that any of you have.
Any questions, comments from Mr. Rubio? Okay, thank you very much. Good
Thank
job.
you, sir.
Okay, epidemiology, public health preparedness, Ms. F.
Chair and members of the board, this is Andrea S., Acting Division Director of Public Health Preparedness Epidemiology. You have my report in front of you. I have nothing to add, but I'm happy to answer any questions that you may have.
A little tied up there, huh?
Yes.
Okay, any questions for?
I think my only question is, how are you doing? That's awesome.
Amazing how you can function on no sleep.
Well, congratulations to you.
Thank you.
Okay, thank you very much. Moving along to Mr. Health Officer. Mr. Dick, go right ahead.
Thank you, Mr. Chair. As everybody knows, we're continuing to have high disease transmission of COVID-19 in Washoe County. And so just to provide some perspective on what we're seeing happening, the report that I provided you was prepared on November 11th, and our 7-day moving average stood at 337.4 new cases per day. Yesterday, we reported a record 610 new cases, and that puts us at about 409 for our 7-day moving average of new cases per day. So it's a critical time for us with COVID transmission occurring in our community. And we are receiving reports from the Hospital Association on increasing utilization of hospitals in Washoe County. As you're aware, these are not just Washoe County residents, but patients that are coming from the catchment area of our hospitals that covers northern Nevada and states, or the counties that are along the California-Nevada state line. And we're also hearing from hospital administrators regarding their concerns of not just the current demands and stresses to our healthcare system. And you've I'm sure seen in the news and heard that Renown is now beginning to utilize the parking garage expansion that they built out last spring. But they're also very concerned about the anticipated continued increase in cases occurring based on the high daily cases that we're happening now, and the understanding that those cases that become severe end up being hospitalized several weeks after they're confirmed as positive cases, typically. So we've ramped up our efforts to publicize the Medical Reserve Corps and try to recruit any medical professionals that are available to assist with surge staffing at the hospitals. We had the meeting with the state's mitigation and management task force earlier today and made the appeal for the state also to redouble efforts with the recruitment for the Battle-Born Corps, Medical Corps, and they are going to be working on that as well. The call center is having a record volume of calls coming in with people concerned about COVID-19, increasing demand for testing. We have increased our testing capacity at the post, and but we're also continuing to provide those specimens to Charles River Lab and the Nevada State Public Health Lab for the actual analysis. The State Public Health Lab does have some delays because of the high throughput that's occurring throughout the state. The state has worked to help to remove some of that throughput by establishing a contract with Quest to cover testing of the Department of Corrections facilities. And that testing was consuming about 28% of the state lab capacity. So that should help. They also, through their agreement with Quest, are providing additional testing capacity to help Washoe County. And so we're working to access that Quest resource and begin utilizing the Quest lab as well for running the testing through Washoe County. With the high number of tests that we are receiving, a high number of positives, our disease investigation and contact tracing efforts are really falling behind. And this is not dissimilar to what's been happening in other states across the country. Some states have dropped the disease investigation altogether and are just focusing on notifying positives of their test results. We are working to prioritize pediatric cases, schools with multiple cases, families in households with multiple cases with ages 20 to 40 type households, household parents, and as well as our healthcare and first responders in those efforts. We're also working on the plans for COVID vaccination. We've had some very encouraging reports on the efficacy of the Pfizer and the Moderna vaccine, running over 94% for the Moderna and 95% for the Pfizer vaccine. We installed a super cooled freezer unit last Friday. So the Pfizer vaccine requires storage at minus 70 degrees Celsius. So we have a freezer operating now at minus 79. So we're prepared to accept the COVID vaccine when it's available. And we've been working with to develop a plan for the dispensing of the vaccine. It will be a tiered approach where the frontline healthcare providers will be in the first tier, as well as our first responders, and then our more vulnerable populations in assisted living and nursing facilities, et cetera, and going on through a four-tier structure to deliver it more broadly in the community. We do have a draft plan that we'll be submitting to the state that I received from staff last night. We're planning on providing that tomorrow. It does include the engagement with our hospitals and our healthcare providers for distribution of the vaccine to get that first tier covered. So a lot of activity that's been going into that. And then we're also working on our plans for how we transition with the Guard currently scheduled to step down, the National Guard with their support on December 13th. And with the CARES funding, which ends on December 30th, are transitioning to sustain the staffing that we've been able to obtain through the University of Nevada, Reno's Public Health Training Center that are helping with our disease investigation activities, call center, post, et cetera, into the new year. We do have the epidemiology and lab capacity grant funds from the federal government, ELC, we call it, of about $9 million. That we originally thought was going to help sustain our efforts through June of 2022. Based on the ramp up of staffing that we've had to do as we've tried to keep up with the expansion of COVID cases in the community, that money is going to run out before the end of June 2021 at this point. So we know there have been discussions about the stimulus bills that have occurred in Washington, D.C., and funding for the contact tracing activities and testing has been part of those discussions. So we're hopeful and we anticipate that we'll receive some funding, additional funding that will help sustain our efforts, but that's an unknown for us at this point. The other piece is the funding for the actual dispensing of the COVID-19 vaccine, getting that in people's arms, being able to do all of the reporting required on people vaccinated, being able to track and manage the fact that this is a 2-dose vaccination and having people come back and be vaccinated the second time, 21 days or 28 days following their vaccination, depending on which of those two that they receive. And so to date, we've only received $74,000 for our COVID vaccination planning efforts. And we're going to need a significant additional amount out of Congress to support those activities. I believe that the Public Health the National Association of City and County Health Officials, I think, has put forward a figure of about $8 billion that they believe needs to be allocated by the federal government for that. So covered a lot of ground there, kind of an overview, but I'm happy to take any questions that people have.
Yes.
I have a couple amazing news about the vaccination potential, and obviously what we're seeing. And I do want to say to all the staff, this is an incredible time that everybody is putting in and keeps pushing and pushing. And hopefully this gives us some hope that we don't just keep pushing for the next years and years to come, that we really can see a shift in this. My question one is, when do we think we'll have the Quest? You had mentioned that before. Is there a timing on when we're going to have that? That's one of my questions.
So we're trying to get an account set up with them. The state is just inked this between Friday, I believe, and Monday of this week, getting that arranged. And the first thing we're working on is to try to get the sheriff's office on board with that testing. The way the state contract is set up with Quest is they have different tiers that will receive different priority for testing and test turnaround times. And so the sheriff's office and detention facility, it would be a congregate setting that's available that has the tier 1 level for a 24-hour turnaround time. So we want to try to get them on so that they can get that quick turnaround from Quest and not be in the throughput on the state lab, and then work through other facilities and ultimately use to expand our testing through the post so that we're not as well sending those specimens to the state lab. We'd be in a lower tier, but we should be able to get 72-hour turnaround time through Quest for that testing.
And how many did you say we can test each week if we have that?
The state allocated 5,000 tests a week that Washoe County could access.
And will that be up and above what we're doing now, or will that take our attention to that direction?
I think it's. I don't think it's a straight add-on. I think what we would try to do would be to reduce some of the tests that we're sending to the state lab now, to reduce turnaround times on their reporting results to us, and speed it up for those other tests that we would send to Quest. So it's not a straight add-on, but I believe we can expand our capacity that we're running through the post the days that we operate, so that we can have additional testing for the community done as well using the Quest.
Thank you. And then just two more things that when it comes to, and not that I need answers now on this, I don't know that we'd have this, but it'd be good to do a little bit of a projection just in the sense of how we can continue to ask or continue to know how we have to function on kind of what's your presumed staffing costs for vaccination. Because I mean, you mentioned that, but it would be good for us to really think about that and help make some priorities where our finances that we do have, because there might be a time we don't get to do everything. As you mentioned, we might have to cut back here or there to do, but it'd be good to kind of look at that. And then obviously the June 2021 concerns me as much as I saw in your eyes. we thought we had some finances to help us through 2022, but it would be kind of good to know what kind of finances do you see us needing to finish out this year? Not just that we're done in June and we're in trouble in a sense, but what do we need?
Yeah, and thank you, Councilman Dare, for that comment, because we are currently using CARES funds to cover the Charles River Lab testing that they're doing for us. And we'll need to also allocate funds for that if we're going to continue with them after December 30th. So that's an additional cost that even further whittles away at those ELC grant funds if we use them for that purpose. The Deloitte contact tracers that we utilize. So we have our disease investigators that cover the disease investigation so that we identify who the close contacts are of positive cases. And then those contacts are sent each day to Deloitte, and the Deloitte contact tracers actually contact them for their quarantine. This is for our lower priority cases. We do a lot of that directly with the schools, et cetera. But that also is going away after December 30th. And so we're exploring what our options are for other support for doing that contact tracing work. I think we had a call with the other health authorities within the last week where we discussed that. And I think the Deloitte costs are prohibitive for us. So we think we may have opportunities to find other entities that can do that contact for us. But we're working on those projections, and we will need to inform the board of that. I think that we will probably need to be risking a commitment of our health fund toward some of these costs to be able to keep us moving forward with the anticipation that we'll get relief from the federal government to cover those costs as we're moving forward, if that makes sense.
It does. And my main point on this too is that just the more we can know, the more we can walk with you, and you don't have to, this is heavy lifting on some of these. This is something we all should do together. A part of it is we do have many of us elected officials that do reach out to our federal delegates and push. And this is a time on this conversation that we need to be using all of our access to make sure we have what we need, because we won't have enough. We know that. And so thank you. I appreciate that. Good job.
And Councilman, I just wanted to let you know also, I agree that we do need that communication and coordination. We're really, hitting some heavy lifts ahead of us here. And so I've asked Ms. Valdespan to set up some standing meeting times beginning next week to touch base regularly with you to keep that communication going.
Thank you so much. I appreciate that.
Novak.
Any other questions, comments?
Yes, Chair. We have Francisco Vega present now. If you, okay. So he could.
Vega.
Actually, Chair Novak, before we go to Mr. Vega, there's one other thing that I think is important that I also cover.
Sure, go ahead.
Yeah. So we're at stay-at-home 2.0 right now, and the governor has announced that he's going to assess where we're at and what kind of progress we're making, and has said that he may take further actions to roll back some of the openings that we've had. Yesterday, Ms. Morgan, Kyra Morgan, the state's biostatistician, distributed a report that the Lancet published in the Lancet Infectious Diseases that was a study of 131 countries and the mitigation measures that they put in place during the first 6 months of the year to mitigate spread of COVID-19. and they assessed what the effectiveness was of the different mitigation measures as far as reducing the effective transmission rate for COVID-19. So the effective transmission rate, is how many people, each person that gets COVID-19 then infects with COVID-19. And if it's greater than 1, then you're continuing to see an increase of COVID-19 disease in the community. If it's less than 1, then you've got a decline in the COVID-19 cases. So we really need effective transmission of less than 1. And this study found that the most effective mitigation measure for reducing the effective transmission of COVID-19 is to limit public events and public and private gatherings to 10 people or less. And based on that, and the science behind that assessment, I made a recommendation that was included as part of the county assessment that went forward to the task force, that the state consider public gatherings and that limitation of 10 as a potential measure if we're taking additional measures to control the disease. It included also an assessment of what sort of effect mitigations would be if we were closing businesses, closing schools, et cetera. But they found that those gatherings and that limit to 10 got the best result, made the most impact. They also had figures on if you did multiple things together, what sort of impacts those might be. So you have a bigger impact when you do more things together, but it seems to me that if we want to try to suppress the disease and be effective in that, and also take an approach to try to preserve our economy and our businesses and people's livelihoods to the extent that we can, that seemed to me to be the first step that we should take, and that's why I made that recommendation.
Okay. Any other questions, comments?
I just want to speak to that for a second.
Sure.
I don't know the right answer. I don't think anybody knows the right answer. So I am no way trying to say here's what but two things I want to talk about a little bit on the how. On that, I would just say the one thing we cannot do, and I think I keep saying this over and over, but I won't stop till I feel like we have a balance. We also know that we cannot do things that make people that cannot pay for their livelihood. And so I'm not sure the ramifications of what you're talking about. So it concerns me. And I mean, the best case scenario is that we put everybody in a room by themselves and they don't get to talk to anybody for 6 months and this thing would just go away. We can't do that. And so a lot of things we could do to try to create health, but we can't do it because it would cause too much harm. I'm concerned about a lot of the harm we're creating by what we've done, the health issues we're having between mental health and you go through. I mean, we just talked about the tsunami of potential evictions coming. And so this would be one of the things I would say we need to be very wise on and make sure what are the unintended consequences of trying to help mitigate what might come. And so that's a concern. And I just hope that we're doing these decisions as a unit. I know you've been meeting. I know you meet often with our city managers and with our county manager. And so together, if we have to make hard decisions, that's how I'd like to make the very hard decisions. So that would be my say, and hopefully that's what we're doing on this. But I would say, please make sure we are looking at the unintended consequences. I get 100% that we would like to see this thing go away quickly, and we don't want to see anybody else get hurt or sick or any of those things. But we potentially are hurting people if we're not careful. Thanks.
Yeah, I appreciate that. I think we also need to recognize that with the exponential growth that we're seeing, and now the impacts on our hospitals and healthcare system, that we need to do something. And it's tough to know what that is. And there was a lot of discussion that occurred on the task force today regarding the issue that we have that COVID-19 has become politicized. And there's a large segment of the population that large segment that wants to take action and wear the masks and social distance, et cetera, and take those measures that we need to protect ourselves. But we also need to recognize, and it's part of the equation with this, is there's also another large segment that doesn't want to change behaviors and doesn't believe that COVID-19 is a big deal that we need to do something about. The reality is we have many people who are sick. We have many people in the hospital, and we continue to have more and more deaths that are occurring from COVID-19.
Okay. Anything else, Mr. Dick?
No, thank you. Thank you, Mr. Chair.
Okay, very good. Okay, next item, we'll move to board comments. Is there any comments, statements, or anything you'd like to see on next month's agenda?
I'm sorry, Mr. Chair. I didn't know if the board still wanted to hear from Mr. Vega on his report.
Oh, I'm sorry, thank you. He's out there someplace, I can see him. Hey, thanks very much. Mr. Vega.
Mr. Chair, can you hear me now?
Now I can hear you. Go for it.
Yes. I apologize to yourself and the rest of the board if I caused any disruption. I obviously was having some technical difficulties, but I don't have anything else to add beyond what was added in the report, but I'd be more than happy to answer any kind of questions.
Okay. Any questions for Mr. Vega? Hearing none, very good. Thank you very much. I think that covers the staff report. Moving on to number 11, which is board comments, like I said. Any updates, requests for agendas or topics?
Chairman, this is Delgado.
Yes, sir.
What I'd like is if there's an opportunity, maybe at our next meeting or maybe even through a memo. At yesterday's concurrent meeting, it was suggested by members that they have a meeting regarding our appeal process at the health district. If there's a way for us to get some information on our current, what our current process is when items are appealed, that'd be great. So that we have that information in front of us before it's asked for by all three jurisdictions with respect to how do we deal with appeal processes and how they would like to be engaged. So, and I could take that as a memo, or we can take that up as a general. Maybe it would be better at a meeting so the general public knows just as much what that process is.
Okay, we'll put that down for next month's meeting. I think that's a good comment to make here.
Thank you.
Okay. Any other questions or comments? Okay, I've got several things. First of all, I want to thank our whole staff and everybody that works with and for the health district. Everybody is being taxed to no end. They've got COVID fatigue. They've got work fatigue. Everybody's just worn out, and it's not stopping anytime soon. When we have a record case of 610, that's a huge amount of work, just moving paper, answering phones, just do that. Want to thank Ms. Reed for trying to keep me on task today. I just kind of drifting off into nowhere someplace. So thank you very much, Daniel. I do want to announce that I've appointed an ad hoc committee to look into compensation and benefits for Mr. Dick, with everything that's been going on. Chief Brown will be chairing it. Councilman Dare will be on it, and Mr. Young will be on it, and they will work with the county manager on some of this topic and hopefully have a report back by next month and see what we can be doing along that line. I got something about 10 minutes before the meeting. I'm sure it'll be made very, very public to everybody. It is from the Nevada Hospital Association, the Nevada Rural Hospital Partners, and the Nevada State Medical Association. It's a joint statement here, and it advises people of what to do. Hang in there if they realize that there is COVID fatigue going on everywhere. And I'd like to read just one paragraph out of this. Kind of gives a lot of gist of what's going on. As our hospitals and healthcare heroes continue to battle this deadly and dangerous virus, we strongly encourage all Nevadans to be careful, responsible, practice safe behavior to protect themselves and others. Ensure our own safety by staying committed to social distancing and wearing masks. This will help all of us protect each other as well as those diligently caring for those in the hospital. After spending the better part of the year dealing with the pandemic and economic consequences and the holidays season approach, we recognize that there is a contemplation to get complacent. Please resist the urge to get complacent. It is vital for everybody to continue keeping the necessary steps to prevent the spread of the deadly disease. And if we can hang in there for another couple of months, there was, AstraZeneca came out with a big statement today on their vaccine that seems to be very effective in the older, more vulnerable age groups, and that came out today. So we've got a light at the end of the tunnel, but we've sure got some black days between here and there. So that's all of my comments. Are there any other public comments, Susie?
I do not have any registered comments, but I believe Dr. Black wanted to make additional comments.
Okay.
Is that okay? Would that be okay if I just said a couple of things?
Yes, please.
Okay,
Just make
thank
your
you.
comments for 3 minutes.
Absolutely. Less than that. Thank you very much. I also wanted to thank Susie and Wes Rubio for speaking with me at length yesterday. I realized as I listened to the business impact discussion just now, how much input had been obtained into this policy. And frankly, I was unaware that this was going on. Not that I'm on your list, although I wouldn't mind being. And most of the input appears to have come from hotels, the resort industry, which is appropriate. Nonetheless, as you heard, we do have some concerns about how to integrate and what can and should be done in short-term rentals. And I wondered if it might be possible to request a Zoom meeting between now and your next meeting to kind of get some think about approaches that might be applicable in those settings that we flagged as areas of concern for our community and I'm sure elsewhere in the county. So that was my request. Mr. Dick, I have sent you commentary on this topic before, but it's obvious this is an enormously busy time with many other competing things going on, and I applaud everybody's efforts in those regard. But I just wanted to make that request and see if that could be considered. Thank you.
Thank you. Okay. No other comments? I adjourn our meeting. We will be back towards the middle part of December. I think we're moving a week earlier next week because of the Christmas holidays. Everybody, wash your hands, stay safe, wear your mask. Just keep your head down and we'll keep going on what we're doing. So pray the new year has a lot of good things for us. So thank you, everybody. I appreciate it. And the meeting is adjourned.